The Malaysian government needs to consider reforming existing policies and laws to counter the spread of HIV/AIDS, according to the United Nations UN Special Envoy on HIV, Professor Michel Kazatchkine. Among the steps that could be taken include decriminalising drug use and ensuring wider access to HIV/AIDS medicine, services and facilities for the infected. Speaking at the International AIDS Society IAS Community Forum today, Professor Kazatchkine said the government should treat drug use as a health issue instead of a criminal offence. He also said research have shown that treating patients for drug abuse was more effective if it was categorized as a health problem.
But if you criminalize people who use drugs, if they will start fear being arrested, this will drive them underground. And this will drive them to unsafe conditions of injections. If they're arrested and jailed, they will go to prisons. And in Malaysia, there's no access to safe injection equipment or to treatment in prisons, as actually in most, if not all, countries in Asia. So prison becomes an additional risk factor by itself.
He, however, stressed that this does not mean that those involved in drug-related crimes, especially drug traffickers, should not be punished. The French physician added the government and society must also deal with the issues openly despite cultural and religious challenges. Meanwhile, Malaysian AIDS Council Policy Manager Fifa Rahman suggested that the government look at the police's Key Performance Indicator KPI as one of the reform measures. What drug diversion is that the KPI is amended so that it is drug arrests diverted to treatment. So when they achieve this KPI, it's proven that police satisfaction increases as well as health outcomes. So what we want is not only for police satisfaction, for health outcomes to get better, but also for police satisfaction to get better and for police to focus very important resources on international trafficking of drugs instead of focusing on human beings. The forum was held in conjunction with the 7th IAS Conference on HIV pathogenesis, treatment and prevention.